Hello everyone, I'm Elle Lee, a licensed clinical social worker and therapist, and I've gone through dialysis and a kidney transplant. I'm so excited to join American Kidney Fund for Kidney Action Week, and in today's mini-series, we're going to talk about common mental health conditions with chronic kidney disease, and I'll share a little bit more about my own mental health challenges while going through dialysis and a kidney transplant and the big lesson that I learned from that. Depression and anxiety are very common mental health conditions with chronic kidney disease. They can show up through all stages of CKD, from diagnosis to dialysis and after getting a transplant. The feelings of anxiety and depression are normal to experience temporarily because chronic kidney disease is a lot to handle, and it can affect every area of our life, from our family, job, even including our mental health. It's important to remember that our mental health is no different than physical health and issues, and we need to also pay attention and take care of it. Although anxiety and depression can be difficult to go through, with support and help, you have the ability to learn new coping skills and ways to manage it better. Depression is a medical condition characterized by persistent feelings of sadness and loss of interest that affects a person's ability to handle daily life tasks or functioning. And in addition to this, other symptoms of depression can include changes in sleep, so trouble sleeping or sleeping too much and still feeling tired, changes to eating habits, unintentionally losing or gaining weight, trouble concentrating, feelings of worthlessness and guilt. Depression can also be associated with thoughts of suicide. So if you're noticing any of these symptoms for 2 weeks or longer, please reach out to people you trust and get some help. You can also check out my next video on available mental health resources for chronic kidney disease. There are several types of anxiety disorders, but today I'm going to focus on the most common type of anxiety, known as generalized anxiety disorder. So a person who's experiencing this will have excessive worries that can be real or hypothetical. And these worries can be about almost anything, whether it's about their health, money, work, fears, or phobias. And the ongoing worries not only make it hard to take care of everyday things, but can come with physical symptoms such as feeling on edge or easily fatigued, having headaches, muscle aches, unexplained pains, irritability, difficulty concentrating, and trouble falling or staying asleep. When I was on dialysis, I remember feeling a ton of mixed emotions and anxious thoughts about my health and life regularly. At the time, I didn't realize how much of an impact going through dialysis and a kidney transplant had on my mental health, because, most times I really didn't know why I felt the way I did. I also just didn't know enough about the symptoms of anxiety and depression to be able to fully express myself in a way to be able to get the help that I needed. And it wasn't until after getting a transplant that I sought help for the first time, and I saw a therapist. And by seeing my therapist regularly, it helped me to learn new coping skills and help me understand what I was going through. And at some point, my therapist and I decided that I would benefit from medication. And with a combination of medication and therapy, it significantly improved my mental health and quality of life. And I'm not saying that that's what everybody needs, but I do encourage you to seek some help, whether that's by seeing a therapist first, if you can relate to any of these symptoms that I mentioned, because I want to remind you that mental illness is treatable. And, the big takeaway lesson that I learned from this is that, I was suffering unnecessarily for years, and I didn't need to, because there's available amazing and great help out there that we can access to help us cope and manage better, so that we can focus on our health and things that are more important to us, things that bring us meaning or joy, and other things that we can focus on, because chronic kidney disease is hard enough, right? That we also don't need to be dealing with anxiety or depression, which is also very common with chronic kidney disease, that we can get some help with that too, so that it makes our lives better. I hope that you will share this video with somebody that you think would benefit from watching this. And thank you so much for taking the time to watch this video, and I wish you all a wonderful day.